Hi, I'm Dr. Samhitha. I'm a board certified colorectal surgeon and proctologist, currently practicing in Lux Hospitals, Gachibowli, Hyderabad. Rectocele is usually caused because of posterior vaginal wall prolapse, and most of the times rectocele in females is asymptomatic, but a few instances where rectocele gets symptomatic is when the patient needs to do finger digitation. They have the feeling of incomplete defecation no matter how much pressure they apply. So these problems will further lead to formation of prolapse or hemorrhoids, etc. And rectocele is most of the times associated with ODS, that is obstructive defecation syndrome. So whenever you suspect a rectocele, we usually get an MRI defecography done just to see the angulation and how severe the condition is. Does it warrant a treatment or can it be managed conservatively? A rectocele usually most of the times is tried to treat conservatively using high fiber diet, lot of liquids, laxatives, etc. But in cases where conservative management is not helping, we go for something called a STAR surgery. STAR is nothing but transanal stapled rectal resection, where we use a circular stapler and resect the area in which the rectocele is present so that the angulation is corrected. Please consult a colorectal surgeon or a proctologist who can further advise and decide if you need the particular treatment or not, and they can guide you better in this condition. Thank you.